Perfect. Okay. Okay. Welcome everybody to part two or our live session two for this particularly fabulous time for you all preparing your journey for the certification. And so I'm really wanted to kind of start off again. If you weren't able to attend the last session or look at the recording yet, my name is Kelly Rossler, and I am the facilitator of these course sessions for you all as you begin again your journey or in the middle of looking at your capabilities, readiness, as well, knowledge and skills to look at identifying areas for growth, areas for that you already have in place, and or looking at professional competencies against the blueprint to help yourself identify areas to look into and to kind of prepare yourself for how you're going to prepare to take the CHSE exam. I know I did a lot of prepare and things of that nature, so I apologize. So part of this whole session today is really kind of looking at going over some of the activities, and some of y'all who might not have been here our last session, we usually go ahead and have you all look at the class session, the live recordings that we have if you hadn't been able to attend. So Hannah will go ahead and put in the place where you actually go to for the live session after as soon as the Zoom recording is ready, she'll put it up into the Moodle there. So if you miss this one or have to bounce out or back and forth, it'll always be there for you. Remember that you all have till January 4th is when your Moodle time ends for access. So you can kind of come back and forth after our sessions end. We'll have this session and three more. So a total of those five sessions that we have to follow up the five modules for this course as well. And so once you're finished, you'll have access to those. Remember, we went over resources. So familiarize yourself again with those resources, and you guys identify how best as a learner that you are to help you look at and identify how you're going to prepare yourself to take that CHSE certification exam. So I wanted to kind of pause a minute here just to ask if you had questions from last week's content or information that I can help you with, or if there's some items that Hannah can assist us with too as our administrator for the Moodle. Okay, not seeing anything in the chat or questions, we'll kind of move forward. And so what I'm going to do is post up here. Again, what we like to do is go through and have you all kind of collaborate together on looking at how to take these activities and these sessions that we have together and do a lot of application, right? So remember, we're just going to be putting on um, our hats, if you will, to look at moving forward with how do I, as an educator, no matter where I work, if I'm a professional who is in respiratory therapy, if I'm a professional in occupation therapy, we always want to have that mindset when you're taking the test questions or you're preparing to, of what would that prudent educator do from any background, because we're all universally looking to have the certification exam, and it comes from those different lenses. And last time we were able to meet to see the variety of from standardized patients to novice to experts that are here taking this course. And so again, everybody's on a separate journey. However, the mindset for preparedness for the exam is from that educator standpoint. So I'm going to pull up the actual presentation that we have that are activity slides. I'm going to start those and then I will share them from my screen for you as well. And we do have some notes and things. Let's see. All right. I'm sharing this screen. I'm just going to push play. I'm sorry, y'all. When I have two screens up, it's not working as well as last time. Let me try this one. All right. Is that better? You can see the full screen. We have, so for universality, we have notes that we like to share. We make it personalized based on each of the class session, but we want to make certain society simulation in these class preps that everybody has that similar experience as in the content, the information, but we create the dynamic experience of this course ourselves as well. So okay, so in here we don't have a notes page. Thanks, Krista. That's more for facilitator notes for me to kind of go over. And it's basically from housekeeping items for me to share with y'all is what it is. Thank you for asking that, though. So on here, we pretty much will have our welcome. And I'm going to kind of go over as well is that, again, we have in this course, if it will keep up with me, information that is looking at how all of the images that we have here are the presentation are royalty free from clip art and things of that nature as well. For some reason, my computer is not, there we go. Um, we put in for this information on the different slides pretty much well, if you, this is from last week as well, if you all would like to, have your screen name show, that would be great, whatever comfortable, um, however comfortable you are with sharing that information. Just this is an opportunity for us to be able to kind of get together and learn about and from and with one another. So that helps us as well. There we go. Sorry, my computer, again, I apologize. It's not on you, it's on me. It's slow for some reason. So when we're thinking about kind of moving forward with domain two, this is really the practices of how you all are going to be looking at what are the knowledge that you have? What are some simulation practices? What are some content that we need to be thinking about? And I really think that this section here, if you're looking at curricular development and there's some terminology that might be new to you, that the simulation dictionary is a fabulous resource for this. I think of that as going through from the video to prepare for the day, realism, fidelity. What do those concepts look like? If that's not in your, everyday use language realm, how does fidelity look at? What types of fidelity are there? So we've got terminologies in there, and I think the dictionary is a great starting point for that for everybody as you're kind of learning or growing or expanding your opportunities that you have. So again, this is the domain we're looking at is healthcare simulation knowledge and practices. And this is a point in time where we truly look at application again. So if we're thinking about application processes, this is our scenario that we have with us today. And when we're thinking about this scenario, we're really looking at putting yourself in the place either in your own setting and remember keeping the hat or the mindset of an educator in place. But we're going to do these applications and kind of see what responses that we get back from you all and have a lively discussion to hone in on these sections or areas. On your self-assessment form for the activities, you can go through that self-assessment form blueprint as well and look through those exam blueprints and then self-identify from areas for growth or areas that you know already that will reinforce. And this possibly can trigger some skills, knowledge, and attitudes that you have for those individual items. So here we go. We set the scene, and you're a simulation educator. You are recommending some equipment for your purchase to your leadership team. What do you need to consider if you're looking at purchasing equipment? So this really is a great item for those of y'all who are new, setting up sim labs, who have them already, who are looking for expansion. So I'd let y'all kind of share or have a minute to discuss, and please feel free to chat or open your mics, and would love to hear from y'all. So what are some of those things that you are looking at and considering as you are looking to purchase and spending money on the equipment? Okay, so we've got one great thing is definitely budget, right? So what realm of budget will I be looking at? Where does the money, where the funds come from that we're looking at as well? And when we're thinking about this in the mindset of curriculum development, who are our learners? Definitely. So we kind of go back to who are our learners and what level of learners do we have and what are our objectives. So remember kind of going back forth in the curriculum. Sometimes people like to do it from a backwards concept. So what's our outcome? What are our learning measures that we seek to go with? And then move backwards in time from that aspect. Some others like to go ahead and start from the beginning and kind of say, we need to add some equipment. How are we going to put that in there, right? But however, we need to caution one another. Remember that it needs to fit the learner, the type of, the scenario itself. So let's kind of see what other information that you all have in here. So yeah, definitely what tech level you're looking for, frequency and use, ability to share among programs, cost and curriculum, utilization, upkeep and maintenance, needs assessment, proof of need. And you should consider your budget. Think about what you actually need, some things you want. Also, figure out how it will benefit your organization. That's excellent. And how about maintenance plans, goal of the organization, and multifunctional? So, those are a lot of responses in there. When you're thinking about putting your hat on for taking an educator type exam, or preparation, kind of start off with those basics again. So if I'm going through, what are my objectives? What are my SMART goals? How am I going to look at my patient out, or excuse me, my patient or my learner outcomes? What does that look like? So then from there, what type of equipment will be needed for those learning outcomes that you have? And go from there to say, well, if I have different types of learning outcomes, what if it were, say, we decided that your learning outcomes were to have, if you have a torso mannequin, you've decided because you're going to intubate a patient, and it's a respiratory therapy school of respiratory therapy, and you've decided you all are going to intubate a patient. So, what are those types of modalities that would be best for intubation of a patient? What do you all think about that? Thinking about your comments of use, multiple use. We want to make sure, are we going to use a $180,000 mannequin over and over again? Would it be a task trainer that we'd be looking at? Would it be a specific type of task trainer equipment that you would buy specific to respiratory therapy students? Or would others also need to use that equipment? Yeah, okay. So task trainer, disposables, those type of things as well. Licenses were good too. Okay. So let me just see this. Okay, so if we're going to do the case of the respiratory therapy and intubation, yeah, a task trainer would be something very ideal. It can go through, depending on the task trainer, your budgeting could get multiple ones of those. You can have more students or learners come through. You can have that equipment set up for there, and you would have that specific for that task trainer. Now, what if we decided, yeah, student volume, how many will you need in the education? So we'd have to budget that out to look at. So if we're looking at building the curriculum from scratch, how do you all start curriculum development? We have an idea. Let's go with the intubation, respiratory therapy. The outcome goal is for learners to be successful for intubation by positioning and auscultation of bilateral breath sounds. So if that might be an outcome for this particular psychomotor skill set. So gaining that familiarity with equipment, and then we've decided on a task trainer. So how would you all look at creating kind of some objectives to meet that goals? Okay, task trainer with haptic device. Okay. So if we think about the task trainer and we think about developing a curriculum to meet those particular goals. And how would we put items in there like terminology of realism or fidelity? How could we increase realism in such a scenario if we have students come in and we've got our objectives, we're fitting into the curriculum? Yeah, I apologize. So I'm kind of going back and forth and I apologize. So let's go ahead and first of all is I'm going to ask for objectives. If you guys were developing curriculum for this, what is one objective or outcome you would like to see? This would be our students intubating a mannequin or a task trainer, showing that psychomotor skill. Okay, ability to properly intubate, communication with the interdisciplinary team, correctly placing the tube. Okay, so we have that. We know that we're going to have definitely, we've decided on our cost. We've talked about consumables. We talk about warranties. We've talked about repair. We know they will have this because then we decided to go with a task trainer. And based on these items with a task trainer, we would need to look again of how we're going to store the task trainer as well. How we're going to use the task trainer for like learning curve or students that may need to be taught differently or they need remediation. So if we have that objective, that's our outcome. Do you feel that the task trainer is the right type of equipment for that outcome based on those learners? Okay, so far so good. Yeah, I would too. So kind of putting it all together for those, we really want that best ideal modality that fits the objectives, the learning objectives, and also the level of the learner. And all of those items that you all spoke about kind of come together for that particular scenario. So, questions about looking at how things you would consider when you're developing curriculum in identifying the type of modality that you would need. Okay. So we're going to kind of go to the next question that is really looking at specifically, if you're willing to share, as a simulation educator, you're working with experienced learners regarding the change of patient-client care processes. When you're thinking about providing care to somebody, who would this group or process be? Who would you like us to look at? We can stay with the respiratory therapy type students or somebody else, some other group. So we're working with experienced learners regarding the change of patient care processes. What kind of group of learners do you all today want to work with? Yeah, I agree. Feel free and unmute, converse, however you'd like to do. Thanks, Hannah. Who will be our learners? You all pick.
Nursing.
Okay, let's go with nursing then. Okay, so by experienced learners, right here, we have experienced learners that are from nursing. Okay, when we're thinking about, we have a question in here by experienced learners. Who do you mean is already licensed? We're going to have them already licensed as registered nurses. They're practicing in a medical surgical unit area. Okay, and when we're going to go ahead and look at process or client processes, what are some client processes that you would possibly think you would need to simulate in nursing education?
Sterile technique.
Okay, great. So sterile technique. So we're going to change sterile technique in our facility. And so we actually have now we have possibly patients that are coming in for a procedure, and they're going to do something where at the bedside, it's minimally invasive, that we need to work on sterile technique. So let's say that this sterile technique process is the insertion of a urinary catheter. Would you all be comfortable with that? So we have a registered nurse who's practicing on sterile technique, and the sterile technique is the insertion of a urinary or indwelling catheter because infection rates have gone high. Okay. So if we want to what? Reduce those infection rates. So now we have kind of the background here. And we actually have our learners already identified. What type of setting will you recommend for the simulation and why? Thanks, Krista. You're doing that this week in the lab. Okay. Appreciate it. So what setting would you all envision that we're going to teach these practicing experienced nurses, and we're going to come to them and say, you know what, our infection rates are high at this hospital. And we've identified that urosepsis is occurring, and one of these factors is possibly the way you're, inserting your catheter. Now you might get some pushback, things of that nature, but don't let that scenario cloud your thinking about an experienced educator and taking and preparing for what this exam, right? So in your mindset, everybody kind of treating everybody equally. We could have them in a sim lab, could be at the bedside, could be a sim lab for a task trainer and a skills lab. Before the sim could be education occurring that practice change in situ. Okay, so if you all have, those are great options. So I would look at those options of a skill lab or a simulation lab setting. If you have a setting that is a lab, we would want it to look like your hospital setting, right? So if you are, would we need would we buy some equipment that is used at, that we teach in school, or would we buy equipment that is familiar to the nurses? Yeah, so we would buy universal items. So especially if you're thinking about IV pumps or things of that nature, right? We want to make sure we have that realism and that fidelity there, but we're also looking at those objectives. So we're always staying within those objectives. We don't need a standardized patient, right? Hey, can we go ahead and stick this Foley catheter or urinary catheter? Can we go ahead and insert it multiple times, right? If you think about nursing populations and either a small or a large hospital, there could be 400 to 500 people, right, that we need to retrain. So I like y'all's thinking. And the main thing about this is to look at if I have to apply it. And if I'm looking at my setting and I'm going to make change in a setting, what's the proper setting that you would have to conduct this type of scenario? The setting also, the scenario needs to kind of match the objectives and those team resources. So if you're in a hospital setting and you have registered nurses doing, if you can use if your hospital facility has a setting, or this actual setting area is a lab or a room that's set aside to conduct simulations, then you can think about that. So we have that realism take place. Um, but we want to make sure that with experienced learners too, it's still could be considered a new process to them. So we want to make sure that we don't take for granted that they know what they're doing. We want to make sure we have those elements of this is how we can repeat it over and over again. This is sterile technique. This is the change that we're going to occur. This is why we're going to have that occur, the change process occur, and then they get to repeat it over and over again. So again, those team resources, we want to make sure that the locations kind of are appropriate, and we can also look at that in situ or in situ situation, where if we're in the hospital, just as one of y'all said, if we're in the hospital and we can go into the a room that replicates exactly what we're looking at in the hospital, or if we go to a lab setting, we want that realism to be there for the learners. Okay. And I think that's a great idea too, is just in time training before the simulation. So have all those pieces. So part of this whole question and answer of this particular one is really looking at the setting again, to match the objectives that you have and to match the type of learning so that we have that realism, we have that fidelity, but what's the optimal setting site to also be able to carry out those action items to meet those universal goals. Questions about that one? Okay. So as we're kind of moving forward, we're also going to be looking at a different type of application. So now you're working with undergraduate students. So how many here work with undergraduate students? I know we had different professions, or if you want to raise your hand. Okay. These can be any type of undergraduate student. Choose those who we're familiar with. That have never participated in healthcare simulation before. So these are very new, who've never been in simulation before.
First year
So,
medical students.
okay, so we're going to do medical students. And so our medical students have not been in simulation. And let's us go ahead with let's just say they are orienting to their clinical practice site. And this is a clinical practice site where the medical students will do their clinical rotations with a preceptor model. Okay. And in a simulation setting, you're preparing them. What is the aspect of the simulation you would concentrate on to promote learner engagement? So if they're here, the idea is to orient them to their clinical setting that they're going to be conducting clinicals on or for. So what are some things to help learner engagement in this case? And remember, they're new to everything. Okay, yeah. So one of the things is, when we think about these learners, we want to make sure psychological safety, well-being is put in there too. And if you've never been in a simulation setting, okay, how can you promote engagement? So let's kind of walk back. Do y'all have some things to share, like when you started in simulation or you're doing some now and you have some new learners? What are some ways that you all ensure psychological safety? Krista, you've got your hand up too.
This is
What?
Lawrence. Orientation to the simulation environment. Have the students go into the room, kind of acclimatize themselves with what is in that room before you
Perfect.
start.
Perfect. So you're having pretty much, well, an orientation there, to all the things that they can take time to kind of touch, to see, to do. Okay. And others?
One of the things that we have done recently, in addition to that, is recorded a video of what we kind of how to move through the room, if you will. Because it seemed like just bringing them into the room next to the bed and so this is how this works and that's how this works. It still wasn't really enough. So I recorded myself kind of going through the motions in a sort of more natural way, if that makes sense.
Mm-hmm.
And that seemed to help them a little bit as well. So both things, I'm not saying one thing is necessarily better than the other, but both strategies to familiarize them with the environment seem to help them feel more at ease when then they had to be in there by themselves.
Perfect. Thank you for that. Because the thing would be is you've got that orientation side, or sometimes, the orientation kind of, what we'll be learning too is how orientation is kind of a bit different because we have that in module 1 from pre-briefing. Sometimes persons have pre-briefing mixed in with orientation, right? So we want to orient to the equipment, orient to the room, get familiar. And this is what the typical room will look like for you, right? It could be that faculty accompany the students into that space, right? And have that time. And we also want to make sure that we keep in mind that learner level as well. So we do have different types of groups of students, ages groups, different lived experiences, especially with medical students coming and going as well. So we want that safe place, or I really like this idea of a safe phrase to use during simulation if they need to stop for any physical or psychological safety reasons. So, and this all kind of comes back to that also fiction contract. That's a great one is, hey, we're going to be doing simulation, but I'd like you to, suspend disbelief. That gets to those key terms of realism. Here for this particular scenario, we really want learner engagement to, and I think I go back to my CPR too of that professionalism, those crucial conversations that you have. So your tone, your constructive, dialogue with one another that you have to create that open and welcoming space. So that orientation and all these phrases that you have together that you all shared are great. So when we think about this too, again, we're still looking at the participant from that psychological well-being. We want engagement to occur. We want to be mindful of the learner level. We want to be mindful of those terms of orientation, pre-brief, and then education level of the faculty too, who are teaching that. Excellent. Okay, so I'm going to kind of move on to the next application slide. Here we have, in this situation, we have a simulation educator, and you all are supporting a user group of a licensed healthcare professionals with whom you have worked for years. Okay, so you have a user group, and let's go ahead and pick our user group who has just completed a high risk, low frequency scenario, and key knowledge gaps were uncovered. How about we go with an interprofessional care team learning CPR? Would that be comfortable with y'all as a scenario? Okay, so we have a user group of a medical team. So we have our healthcare professionals. We'll say they're in an emergency room setting where we have a med tech, an RN, a medical physician, respiratory therapist, and maybe a charge person, administrator. And they all were completing CPR and following a American Heart Association code guidelines for that. And when you're looking at knowledge gaps that were uncovered, what is concerning to you as you head to the debriefing room? So let's say this knowledge gap was on appropriate use of a ambu bag or a face mask to operate, and possibly compressions. I'm going to say we saw a gap of education in airway management and compressions for this scenario. When you're going and you're heading to the debriefing room, what are some thoughts that come to your mind? Okay. So we've got some okay, so coming to mind kind of scene of wow. What were those in my mind that we saw? We identified two gaps is there, and setting yourself up, kind of looking at this possibly could be a difficult debriefing, right? I want to make sure as I'm walking into that debriefing room and I'm gathering my thoughts as an educator and a simulationist who is certified, that the debriefing might have some crucial conversations that we're going to have or dialogue, but I want to make sure that I still maintain that psychological safety. But we also want to make sure that we take in mindset the maturity of the group that's there, and also that the maturity or the knowledge of that educator, because there may be different styles that may be used to promote kind of a more organic discussion and reflection, right? So we had some comments about how do we get them to reflect. It could be you do start off with, let's go ahead and use our model of debriefing. So when we think of types of debriefing models, say if we're going to use a model of what went well in the simulation today, we can ask those participants, right, and get their feedback from that. We've got some great feedback here of why it happened, communication during the time frame. So Kelly, thank you so much. I'd like to ask the group how they thought the scenario went, positives, and what they think could be worked on. So that gives an opening for our learners to be able to share their thoughts, their feelings, their emotions as well. Um, were they pre-briefed properly? That could be something else. How did the pre-briefing impact your, abilities when you were doing the CPR simulated scenario? So we want to just make sure that again, that we set those expectations of the debriefing. So this is a debriefing to look at our knowledge, our skills, our abilities. We're going to debrief based on the objectives that were for the CPR. In the CPR area, can you tell me more about your thoughts on how well or the action items related to use of the AMBU bag? Okay. The learners may not even be situationally aware that there was an issue, right? So how they felt it went, strengths, and think about their emotions. So emotions as well as in action, how are they doing in action, and then on the action itself are some great thoughts there. So when we think about forced aside simulation, and you're thinking about the application of this particular item, we talked about structuring the debrief. How is this different from your approach with a novice caregivers that have never been in a simulation? So this, if we had more novice caregivers, so if we have a brand new team, say our medical residents and nursing residents, we decided to get together and do a CPR um, education day with them, right? They're all certified with CPR, have American Heart Association or your country's association for CPR use. How would y'all approach, or would you approach the novice differently? Okay. Review steps, responsibilities. So one of the things that we can do is definitely start back again at those basics, right? Of identifying the level of the learner, making certain that we reflect back on the objectives and going through, while society simulation doesn't have particular style or for a facilitator in the course itself, we want to possibly have you guys hone in on examples of like plus delta model. What went well? What do we need to work on? Or advocacy inquiry models, just as you all have been doing. Inquire from them, be advocates for the process of learning, but then also have them look into and self-reflect on their own actions that they had. We want them to take a deeper dive as well. So if a peer has brought up something unfamiliar to them, to be prepared to use those that well-being concepts and guide those learners. So yeah, let's go back to the beginning. Education responsibilities to policies and place needs assessment. All right. So getting back to the basics, kind of coming back to the educator role of did I orient well? We did debriefing, keeping in mindset of the maturity of the learner, the educator, wrapping it back up into those items that are reflecting on learners. What are those main points that they needed to get out of this and how it reflected back? Okay. Questions about that? Remember that debriefing usually has phases, right? So, and sometimes in that phases, as you are looking at debriefing, if we start the beginning, we orient, we start the mindset of the debrief. We want to make sure, if we need to have some structure to the debrief, definitely. And we might need to do some cueing and prompting for those who might be more novice, right? To kind of cull out some of those reflective pieces that they may have. Okay. Thoughts about this particular one? Okay. So we've got some good thoughts about, so kind of going back when you see these kind of application phases too, what I encourage learners to do is kind of go back and kind of see, well, this is really asking me about level of learners, and it doesn't matter what, we can do what. You'll see here universally, we're not going in through this test to take it as registered nurses or medicals or respiratory or standardized patients. We're looking at it as any type of learner, that universal educator hat on. You're a simulation educator and you have a group. So we need to identify the group. We need to look at some, knowledge gaps for discovered. We need to concentrate on what is debriefing. So the dictionary is great on debriefing as well. What is debriefing? How do I familiarize myself with plus delta or advocacy inquiry? What are components of that debrief? How would I cue a novice learner? And how do I gear it back to those structured type of debriefing? What does a debriefing look like? And then also, maybe I have to do some prompting or queuing through this structured debriefing process. So kind of when you see these application questions, kind of put your mind self in, oh, it's asking me about debriefing, how am I structured debriefing? How does it relate to everything else? Okay. All right, let's go to the next one itself as well. Here's an interesting application. So briefly describe a system integration or process assessment event that you have implemented. Okay, so this could be some type of process. This is kind of our last slide for this session. So I kind of want to provide y'all with an opportunity to kind of see what might be something you'd like to share from your facilities that was a process integration or an assessment event that you implemented. So if you think about a new system process, I think of sometimes of in the hospital setting, or like if we implemented SBAR or communication technique. Kind of take us through some of the things that you all looked at. Who were your groups? Who were your learner levels? What were the objectives? What was the education modality you looked at? What was your setting? Did you use a checklist? Did you have scoring rubrics or data collection instruments? If somebody would like to share, and happy to have you kind of share an example. Yeah, Kat.
Well, since you had mentioned kind of SBAR, I'm the director of our standardized patient program here at Tulane University. And one of the things that we were wanting to know is, do our third year clinical med students, do they properly know how to hand over a patient? So in nursing, it's a little different when you're transferring a patient from, the night shift or whatever. But for physicians, it's there's IPASS or other little acronyms. And so one of the things that I had to come back to was, what were the basic components of a basic patient handover? So first I had to do the research and basically figure out what those basic components were. And based on a double AMC publication, I kind of teased it out, kind of a very generalized acronym. And then basically we put it through our OSCE. So at the end of our third year, we have a 5-station standardized patient OSCE that students come through and they rotate through. And so our typical time is, there's 15 minutes in with your patient. Then you come outside of the room and you have 10 minutes to do a SOAP note or a EMR. And then you rotate to the next case. Well, because this is a little different, like with the timing, we actually did a reverse timing. We had the student review a chart for 15 minutes and say, okay, this is the chart that, this is a patient that you were monitoring overnight, and now the new shift is coming in. So now you're going to have to hand over your patient to the incoming resident. And so they would then go back in the room for 10 minutes and meet with the SP while everyone else was doing their write-up, and do a quick 10-minute handover or handoff. And we had a basic checklist. It included, did you identify your patient? What were the basics? What were your action plans? And then we actually had a kind of a professionalism component. Did you talk loud enough? Did you turn? We actually had music playing in the background. So they were to request to, hey, can you turn the music down so you can hear them? And so there was just like a basic, yes or no kind of situation. The standardized patient was then also supposed to say, hey, can you tell me the ins and outs again? Or what was that? I don't remember if you said that they like, what day did they get stepped down? And, just kind of something about what the student told them. And then after, they, based on the checklist, they would get a score. Well, what we found was the standardized patients were one of the key things with standardized patients is the students are not supposed to use medical jargon with patients. But when you're in this type of situation, they used tons of medical jargon because it was, you're talking to a peer or somebody who should understand. So we had to actually train our standardized patients on a lot of medical jargon. So we had to add that to the case. Here's a list of things that you're probably going to hear, and this is what they mean. The other thing that we encountered was we initially had the way it read was that it was an intern. So you are a peer, but students were interpreting that as a higher up, like somebody above them. So one of the things that you were supposed to do is you're supposed to confirm that the individual understands what you've just told to them. And so they then students were having trouble confirming to somebody who was a higher authority, like, hey, can you repeat that back to me? Can you let me know that you understood this? And so they were almost like being too polite because they were told in clinic, do not question a resident or do not question your faculty member. So we kind of had to adjust it so that they were of equal rank so that they didn't feel as constrained or to not have to question somebody. And so that was another little kind of interesting fact that we kind of learned from the handover position. But that's kind of it in a nutshell. But it was we actually found that the interesting part is we didn't have curriculum in our med school that discussed this. So we wanted to know how they were actually getting this material. And so the idea was that when they were in their clinical rotations for their clerkships and for their third year, they were watching, they were actually participating in, and they were getting this type of information, which was kind of an interesting fact. So.
Yeah, I love this. Thanks so much, Kat. So when we kind of think of this scenario, we've got our, the users, you've identified those medical learners, what the level they are, what the objectives that they needed to do for an SBAR or a communication technique as well, and the educational modality. So if it was a simulation there, they had the modality as the standardized patient. So that helped with that fidelity, that realism of, and really having somebody there in front of them, facial features, frowning, not frowning, that communication techniques that you learn from informal or formal communication, or just the, facial expressions as well. The setting, making that look realistic, in your checkoff, right? Your checkoff list, it was in the form set of a high stakes type of testing as an OSCE. You had that instrument. So when we kind of wrap this up, do you all think that it's based on this, that these changes helped possibly impact patient care outcomes? Or I know it was a training session, Kat, but do you think that might be feedback might have shown?
Oh yeah, no. See, we actually did a post an evaluation, kind of like a query that asked them, did you think this was realistic? Was this something that you felt helped, or did you understand, the basic concept? And one of the things we asked them was, how many times have you actually seen or participated in, or actually in your clinic, did you actually hand over a patient? And based on their information, they've overheard it and they've seen it done, but they never themselves had to actually relay that information. So the feedback is that this was great practice because I've never been able to do it. And it then allowed me to organize my thoughts and provide that information. And it also gave them a kind of a basic idea of how well they did, because it was scored. So it was kind of not necessarily graded, but it was scored to them of, hey,
Sure.
you missed these. About family members, like the family, that was one of the things, is that the family members wanted to be kept informed. So that was a key thing. So make sure you're not just focusing on your patient, but there is other things that are aspect to it. So they felt like they had a better understanding, so that when they actually did graduate and they became interns, they were more comfortable in that type of situation. So
Yes, I
yeah.
love that because even you articulated, gosh, we had to go back again and make adjustments too with the jargon for the standardized patients to prepare them for that way. Then the next simulation that you have or the next learners, you'll have that incorporated in there. Thank you so much. And I think I'm going to look really quick in our chat. I would encourage everybody. We had one where it was the STEMI protocol for a facility that getting better at door to balloon time. Both providers and ICU charge nurses were involved, as well as med surg nurses. So this is a great simulation where you're thinking about, let's institute this protocol. Here are a level of our learners. We're doing in this environment because we want to have good patient outcomes, especially for our balloon entries. And if we think about that simulation technique, how do we learn from that, and how do we reinforce protocols or policies that are often changed or in the hospital or different practice settings? And I really appreciate this one too. Ashley, thank you. We created a remediation policy for undergraduate students, looked at how they're doing on exams and areas they scored low, and found they weren't going back to remediating. So I think, remediation sometimes with learners, it takes on a different context. Oh, I've got to go remediate. It's a learning opportunity, right? So we provided that. So thank you so much for sharing these. And what I think take away home for these applications, again, for me, is for you all to have like these exemplars. Have an exemplar that you have used or currently use, or take one from the sessions that we have, each of these, and put those and write those out against a scenario that helps you remember and recall pertinent items that you're learning throughout. So that way you have that application and you're not caught off guard with those concepts. So I'm going to stop sharing here. And I do apologize, as I was getting my system all set up, that I was a little disorganized. So I appreciate your grace and patience as well. And so I want to just remind you all of your kind of resources that we have for you here. Make sure that you check out the Moodle pages going forward, and also the live sessions will be available. The dictionary, I think, is one great one to kind of hone in on. So some of the terminologies. And as you're going through the video, I really like that you can stop and pause. You can ask questions too on the recorded session. So I've responded to some questions there that were asked for the first module, just to kind of reinforce. So those are extra type of resources that you can use. So in our last few minutes, I'd like to open it up to you all and to see if this was helpful today, as well as any questions that you might have. I really appreciate you all sharing your experiences, because that's how we can learn from one another and have those exemplars in mind, to kind of say how realistically, because sometimes we can get in our own head, the forest for the trees, right? Oh, what are they asking? And we just need to put it kind of keep it that focus content, right? They're asking about debriefing, or they're asking about objectives, or asking about curriculum. How do I line that out, and what are those best practices? Sometimes what you can do too, I think is great, is to go back and, as you created your scenario that you're going to learn from, and develop your own educational platform to kind of help highlight your strengths and areas for growth as you start to prepare yourself and gain insight of how you can learn for the exam, is to kind of look at and have these different exemplars here. If I were going to change it this way, what other modality would I need? If I were going to put in more functional fidelity, what would that look like? So that way you have those in your mindset. Okay. All right. Any housekeeping items that we can assist with as well?
Kelly, where do I go to get the recorded version of this that we just had? Do you have access to go back and go through what you just presented?
Yes, you do. Let me, can you I'm sharing my screen. I should be. Can you see? It's not sharing. There we go. It's just delayed. So if you look here, I'm going to go back to, there's the recording. That's normal recording live session.
Yeah.
And right here, it'll say part 1, part 2. This is the link to access the recording for module 1. When the recording for module 2 for today is up, then Hannah is very speedy with this, and you'll go to live session, and then you're going to see it in this area over here. So if you link on the live sessions is where you're going to end up seeing those recordings.
Okay. Thank you so much.
Okay. Yeah. Thank you for asking. Okay, I think our time is done here. Again, thank you all for being engaging, and I welcome any questions that you may have via email until we meet again next week.
Thanks, everybody. Have a great rest of your week. Bye, guys.
Bye.